Let's practice abdominal assessment. What is the current sequence? So during your nursing exam, you will see this kind of question. So never skip any easy topic or any easy question, because sometimes we think, oh, I know this topic, but during your exam you will get confused. What is the correct order, correct sequence? Which one comes first? Which one comes last? So yesterday I posted a video, but I posted from the draft, so there was some error which I noted immediately and I deleted. So I am recording this video again with the same topic. So the correct way to know your answer is, so in this question they're asking what is the correct order for abdominal assessment. So there are two things you need to know. One is abdominal assessment. The second one is lung assessment. Right? So when they are asking you about abdominal assessment, abdominal sequence, you have to know this. The sequence you have to remember like this: I, A, P, P. I, A, P, P. So I stand for inspection, right? The A stand for, so when you see A, this will immediately bring you that the question is asking about A for abdominal. See, that's the trick. A for auscultation, right? Culthion, auscultation. P for percussion, Pussion, percussion, and the lastly is palpation. That's the current sequence that you are going to use, IAPP. So A stand for abdominal. So whenever the question is asking about abdominal assessment, use this IAPP. That's the abdominal. So if the question is asking about, so what is the correct answer on this, on abdominal, question number 1? So the current answer is IAPP. So your answer comes as answer B. That is your first answer. Now go to second question. So the second question said the nurse used the proper sequence of assessment of the lung, which is, so now we are talking about lung assessment. So lung assessment, what do you have to do? I will stay as it is. You will switch palpation like up and upside down like this. So next one will become inspection, palpation, percussion, and lastly auscultation, inspection, right? You got it? So lung assessment. So as we know, the second word is IA, right, on abdominal. In this one, IP. So when you see P, it will bring you directly to P for like pleural. Pleural means lung. So this will automatically bring you to lung. IP, P for pleural. So that's means the question is asking about lung assessment, right? So that's the current sequence: inspection, palpation, percussion, and auscultation. So I hope you will remember this trick now on. So let's see like this. So this is the body, right? So inspection means that you are going to look for their like abdominal area to see if there is a symmetry, if there is any wound or skin turgor or temperature of the body. Not temperature of the body, but is there any visible symmetry or dissymmetry, if the body looks like okay or not okay. That is the first inspection. Secondly, you will auscultate. You will hear the vowel sound. So you will start with right lower quadrant, then you are going up towards right upper quadrant, then left lower quadrant, left upper quadrant, and left lower quadrant. So you will go clockwise like this, and this. That's the auscultation. Percussion means like you will put the finger on right lower quadrant and tap it like this. Check for any tenderness like this, right? Lumps, tenderness. And lastly, palpation. So you will palpate. So now instead of tapping, you will apply some pressure like this. And you will ask the patient if you have any pain like this, right? So just remember this technique. For abdominal inspection, IAPP. For lung, IPPA. So just switch this upside down like this. So that's the correction I wanna do it on this video. So I hope everything is clear now. So for lung, second question, the answer is answer A. And the last question is, how often should normal bowel sound be heard in each quadrant of the abdomen? So when you hear from the abdomen, the normal sound should be around 5 to 35 times per minute. That's mean answer A. So in case in your nursing exam, if you do not see 35, you will see around 5 to 30. So whatever is close to 30, that will be your answer. So answer A at this time.